Hi, my name's Christine. I'm a family nurse practitioner and a certified menopause provider. I just wanted to take a moment to talk about vaginal estrogen therapy. I think that a lot of patients and even providers are afraid to use that, but I just wanted to reassure you that it's a very safe medication. It's it's a topical treatment, so it's different from systemic estradiol like the patch or oral therapy that you might use for menopause replacement therapy. Vaginal estrogen cream or tablets can be used if you're having symptoms like vaginal dryness or painful sex. We used to call it vaginal atrophy, which, as a woman, I find that term unpleasant. And so, fortunately, they have changed the name. So it's now called GSM or genitourinary syndrome of menopause. And so, there are a lot of potential symptoms that you might have during this phase, such as vaginal dryness, like we have mentioned, or painful sex. You might also notice burning or itching or irritation of the vaginal area. Essentially, what's happening is the lower levels of estrogen are affecting the tissue of your vaginal area. And so that can present as GSM. And so the gold standard is to use vaginal estrogen therapy, either cream or tablets. Again, it's very safe. You don't need progesterone with it because studies show it doesn't affect the endometrial lining. So there's no risk of hyperplasia of the endometrial lining, which can lead to endometrial cancer. So again, very safe. It also doesn't increase your risk for blood clots. So different from systemic therapy where you have some of those risk from it, although very low, but because you're applying it topically, it's a localized treatment. So it doesn't increase those potential risks. So again, it's standard of care if you're having vaginal symptoms. It could also help with things like if you're getting frequent UTIs, you might try vaginal estrogen therapy. Some other potential indications would be urinary incontinence, either stress, so think like sneezing, coughing, jumping, laughing, and you're having some leakage. Another one might be urinary incontinence from urgency, so that need to go to the bathroom and you're rushing to get there, maybe not making it in time. So it's such a conservative treatment that it's worth trying. Another really great intervention for urinary incontinence would be working with a physical therapist who's trained in pelvic floor therapy. A lot of times, as our estrogen levels decrease, it affects the tissue in that area, but also affects the muscles in that area. And so, if you've had a history of pregnancy or vaginal deliveries, that also puts you at an increased risk. And so, working with a physical therapist to improve those muscles will also improve those conditions. I hope this was helpful. Leave a comment if you have any questions, or feel free to reach out. I've included the links to my website on my YouTube channel, so you can learn more there. You can also go to the Menopause Society provider directory to find a certified menopause provider in your area. I usually recommend selecting the telehealth option and then your state. You're going to get more options that way. All right. Have a great day.